reported, though, there's still a lot of demand for a limited supply of vaccine, and that situation is leading to questions about who is being vaccinated and why.
Several viewers reached out to us asking why doses went to healthcare employees who have no contact with patients, and in some cases, to volunteers. I-Team reporter Kat Reed goes in depth to answer those questions.
People are desperate to get the COVID-19 vaccine.
I have signed up on every single thing that I can sign up on.
With so much frustration about access, we've fielded a lot of questions about who is receiving doses. One viewer reached out about board members being vaccinated at St. Luke's, another about volunteers at Children's Mercy. To be clear, all of the major health systems in our area started by vaccinating their frontline workers, those who come face-to-face with patients.
We started with the people that had the most contact, and then we worked our way down until we got to finally the group of people that we would call non-clinical. So these could be support staff, they could be call center staff, they could be dietary.
Eventually, the health system vaccinated people working remotely.
Not everybody that is homebound or working at home is always at home. Sometimes they're coming back and forth, right? Our IT support, we had people go, well, why are you vaccinating your IT? Well, IT does everything from keeping our computers on to making sure that the equipment, technical equipment in an operating room is functioning and working.
The University of Kansas Health System is the only one that would explain its process on camera. But St. Luke's, Children's Mercy, and Truman Medical Centers also vaccinated their remote workers. HCA Midwest provided a statement about vaccinating healthcare workers, but didn't respond to multiple emails and calls to clarify who exactly they meant. Now, moving on, we also confirmed some systems did offer doses to their board members, but it happened in the very last round of vaccines. At the University of Kansas Health System, all board members were invited. Some had already received vaccines, though, because they're practicing physicians. The others met the criteria for the current phase. Similarly, Truman only vaccinated board members who fit within the open phases in Missouri. St. Luke's and Children's Mercy also said they offered doses to their boards.
If you're safe and remote, you don't need to be vaccinated.
Dr. Arthur Kaplan created the Division of Medical Ethics at NYU School of Medicine. He disagrees with board members receiving vaccines if they can meet virtually. But when it comes to remote workers overall, he pointed out a lot of decisions were left to health systems.
They define who's an important worker, and part of the answer is a lot of people fit the bill of important workers.
Missouri and Kansas included both paid and unpaid healthcare workers in early phases. Children's Mercy vaccinated volunteers who come face-to-face with patients, saying they're essential. The University of Kansas Health System took a different stance.
Volunteers didn't have to be here.
As the vaccine rollout continues, Chadwick emphasized the health system is playing by the rules and waiting for the day when doses will become widely available.
There are a lot of people here in the health system that would gladly have given their shot to someone else. But it is our culture and our belief that we got to take care of the people that are taking care of other people.
I'm I-Team reporter Kat Reed, 41 Action News.